anticipatory action for health for pastoral communities in the Horn of Africa entails working together between communities, non-state actors and state actors to prepare in advance of a shock such as drought.
Pastoral contexts in the Horn of Africa suffer from this historic marginalization, which means that health service delivery in these contexts is not necessarily as strong as it is in other parts of the region. And that results in generally poorer health outcomes for pastoral communities in the Horn of Africa. The people most affected by health challenges in pastoral regions is obviously pastoralists themselves initially, but within that then there are gender dynamics, there are wealth dynamics at play, so poverty is a significant issue.
In pastoral systems, such as in northern Kenya, the segments of the population whose health is impacted the most by shocks such as drought and floods are people that are possibly more marginalized, such as women and children.
Typically, women have less voice in the community and less autonomy over health outcomes, and also suffer different exposures to men in this context.
With increasing droughts, more and more people have lost large amounts of flocks, increasing their poverty levels. So the people that are more poorer get their health more affected by shocks.
The other group that is significant in the question of anticipatory action for health in the drylands of East Africa is actually the government themselves, because the opportunities that anticipatory action presents potentially saves the government resources and therefore allows them to have better service provision for health in these regions.
The key to anticipatory health actions in the drylands lies in two main folds. The first one is to understand the pastoral context as integrated between people, ecosystems, livestock, and therefore this demands a very integrated approach to establishing anticipatory actions.
One is a much stronger integration of informal or community-based health with formal health structures that the government or NGOs are running.
The second one is really realizing that the health system constitutes both the formal and the community aspects. Realizing that pastoral communities have very established customs and practices, it's also important to consider community health and the various actors that play a role in providing health at the community level.
And the other component is a more holistic One Health approach, which really looks across the human, animal, and environment components, because those three pillars are so fundamental to the pastoral system.